Hi, Dr. Rao.
Hi.
So you're a urologist. In your practice, do you see men, perhaps that you did surgery years ago on, come back with recurrence, or do you have new people coming into your office with perhaps metastatic disease or PSAs that elevated in a surprisingly brief period of time, hence rapid doubling and such?
Sure. Yeah. I think what you're referring to is sort of patients with more aggressive forms of prostate cancer. And every urologist in this country is going to see that. It's one of the more difficult sort of situations to see somebody in, but fortunately, we have multiple ways to sort of treat cancer, which may have spread or that's more aggressive. So, in particular with patients that have very elevated PSAs or who have cancer recurrence after a prior treatment, variety of options exist. Nowadays, sort of the newest kid on the block, you might say, is a drug that's used to target genetic mutations which exist inside the man who has prostate cancer. So, what's exciting about it is that men, first they need to have genetic testing done to even identify if they have a mutation, which is a target for this new type of treatment. It's a pill-based treatment. Should they have that treatment, that DNA mutation, essentially what's happening is that your body has multiple ways to get rid of mistakes that happen. We all make mistakes on a day-to-day basis, but when your body is sort of reproducing cancerous cells rapidly, there's sort of internal mechanisms which prevent that from happening right from the get-go. In some people who have DNA mutations, they lose that ability to put a brake on the bad cells from being formed and then doubling and tripling and multiplying rapidly. So for those men who have genetic mutations whose cancer is spreading or spread already, there's a new form of drugs out there, a new class of drugs called a Parp inhibitor. And what those do is they sort of put the brake on that bad process from happening in a rapid fashion. And by targeting the mutation in particular and not sort of being the older forms of chemotherapy, the side effects tend to be less pronounced. Decades ago, chemotherapy would sort of stop all the cells in your body from replicating to varying degrees. So you'd see more side effects all throughout your body. Nowadays, with these sort of newer forms of prostate cancer chemotherapy drugs being present, a lot of those sort of system-wide side effects that could happen through your body aren't as bad as they used to be because of years and years of medical research and finding new ways to sort of treat prostate cancer.
So, this sounds super. In order to find out whether these PARP inhibitor drugs, and I imagine there aren't many different versions of them, is that right?
There's about 2 drugs out at this time.
Right. So they're only useful for about a quarter of the guys, is that right?
They're useful for the patients who have prostate cancer and a mutation.
Right.
So the percentage of patients who have a mutation probably varies between 5 up to 25%. Mm-hmm. And those patients who have the mutation, I guess maybe a better way to put it is you're more likely to have a mutation should you have a more aggressive form of prostate cancer, should you have cancer that's already spread, if you have a strong family history of cancer. So that 25% range is probably going to be more associated with people who have multiple risk factors for having a DNA mutation.
In order to find out whether you're in, let's say, that 25 and under percentile or above it from 25 to 100, meaning 75%, it's a simple test to find that out. Is that correct? Can you talk about that?
Yeah, certainly. So, first thing is you're going to discuss with your urologist, should you want this testing done or not? And should you choose to have it done? The 2 most common ways to do genetic testing is either a simple blood test, which is done in the office, or a saliva test, which you could do at home, depending on which genetic testing company the urologist may use. there's different ways to get those tests done. Some people can do them at home. Some people only do them in the office. So those little details are figured out with your doctor.
And it's just blood or saliva, right?
That's right.
So by figuring out, would it be fair to say that everyone today in 2020, going into 2021 and onward, who presents with recurrence, with an elevated PSA after primary treatment, with concern that they have an advanced stage of prostate cancer, should either have blood or saliva tested for whether or not these two Parp inhibitors could provide a viable treatment for them?
Yeah, I think that you need to be aware of what's available. And I think for any patient with advanced prostate cancer, genetic testing is something that really needs to be considered because it opens up treatment options that weren't available to them before. And whenever you're taking care of patients who have aggressive cancer, any possible weapon that you can use to fight that cancer you want available to you. And the only way in which you're going to find if a patient has one of those potential targets to fight the cancer is to do genetic testing for Parp inhibitors in particular.
So who does an advanced stage prostate cancer patient talk to about genetic testing?
Sure. So they could talk to their urologist, oncologist, whichever doctor is the one who's primarily managing their prostate cancer. Most patients with prostate cancer are going to be seeing their urologist, and they have a fairly good rapport. I personally think urologists are pretty easy people to talk to about these types of issues. And I think that their urologist could provide them more information about testing and help them get it should they seek to do so.
So as an advanced stage prostate cancer patient, should I assume my doctor is just going to order up these tests?
No, for this type of testing, honestly, you should have that conversation about the testing. It should not be done reflexively on everybody. But I think with advanced stage prostate cancer, you really could make a case to strongly encourage your doctor, or the doctor should strongly encourage the patient to consider this type of testing, because there are new treatment options that are available for those patients, which could provide better survival outcomes than they would if they never had the testing done before.
So as sort of nebulous as all treatment pathways and decision-making pathways and decision trees are for prostate cancer, this one seems almost a no-brainer. If you have a recurrence or if you're an advanced stage prostate cancer patient, there are two possible treatments that may help a small percentage of patients if they have this criteria that fits the mechanism of the drug. There's a test that just requires saliva or a simple blood draw.
That's right.
It seems like that's just an obvious thing, assuming it's, affordable and accessible, and the doctors know how to interpret the results appropriately. Seems like everyone in advanced stage, presenting with an advanced stage, should do a genetic test. Is that fair?
Yeah. That's really fair. Currently Medicare has approved prostate cancer genetic testing in anybody who is currently or may ever be eligible for a Parp inhibitor drug. So if you have advanced stage prostate cancer, the government has sort of given that type of testing an approval because if you're eligible for that drug because you have that mutation, we will see better outcomes in patients that are on the appropriate treatment. So it's a big deal. That isn't something that is easy to come by, a treatment that's so much more beneficial to the point where testing is now being covered by all insurance carriers for, I shouldn't say that, I would hope all insurance carriers, but you just never know, but it should be covered by insurance across the country for anybody who has prostate cancer that's spread.
Now, are the results like a cut and dry kind of report? Like, yes, this patient is appropriate. No, this patient. Are these tests as interpretable as a pathology report?
Yeah, so pathology reports are difficult to interpret, I would say. But when it comes to these types of tests, yeah, I think it's very helpful to get a copy of your actual test result, and your doctor can provide that to you. And the tests, there's a variety of possible sort of results that may be available. One is positive, which, in this case, positive is bad. You have a gene mutation. I suppose it's good in the fact that we do have a treatment target that could give you a better outcome than patients who don't have that gene mutation. So positive is one. The next one would be negative. So there's no mutations that we found, nothing to be worried about in terms of what we currently know about genetic testing. Then there's this sort of middle category that's sort of gray and a little bit cloudy and difficult to sort of interpret or maybe comprehend for patients until it's explained to them well. And that's called a variant of uncertain significance. So a variant of uncertain significance, essentially, it sort of explains itself. What they're saying is that you do have a gene mutation, but we currently, with the knowledge we have available, are not able to categorize that mutation as nothing to worry about, or it should be something to worry about. So most of the time, what'll happen is that if that testing company should find that mutation becomes something bad, they will notify your doctor, and your doctor should pass on that result to you. So when you do genetic testing, it's important that you remember that for the rest of your life, you stay in touch with your doctor who sent that test off. And should you move from New York to California or something along those lines, you give that doctor who did that testing your updated information. So should that test ever come back to say the variant you had is something bad or good, you get that answer. Now, the majority of patients that have variants of uncertain significance, the mutation will not be found to be bad as of today. So roughly 80% of those patients, those mutations are not going to be bad. So you should not be terribly afraid that something is going to be found that's going to be detrimental to you. However, you could be one of the small percent of people where that variant is found to be bad. So you do need to be responsible and stay in touch with your doctor and at least give them updated information should you move or whatever may happen.
This is so cool. I mean, we've lived long enough to see the cusp of precision medicine really coming into the prostate cancer world.
That's right. I mean, it's such a fascinating time in terms of prostate cancer and sort of making big leaps and bounds from where we were years ago. I mean, in the last several years, there have been multiple drugs that have been created for prostate cancer that are way better tolerated than what we had before in terms of side effects. And also we're seeing better outcomes in patients because of pill-based treatments. It's not always an IV or a port and things like that for cancer that's spread. And any new drug target that we can find is going to be beneficial to the patients of today and the patients of the future. The more and more mutations and different targets that we can uncover, I feel like that is going to make a difference for the future of men who have prostate cancer and their children and the world in general. It sounds a little crazy to say something that, speaking, in such a way like to say that it's going to improve the world. But if you really think about it, medical research and finding these treatments, it takes years for that to happen. And it takes a lot of time, a lot of effort, and a lot of brilliant scientists across this world to sort of come up with these sort of ways to fight cancer in a smarter way. If you, as a patient or your doctor, is able to find a new target for these people who are sitting in laboratories that are trying to beat this disease, they're able to find a new target for them. I mean, think about the good that the world is going to, the good that happens in the world from the result of that. So, I think the genetic testing in prostate cancer, although it can benefit the patient, it can help countless people down the road. Should we be able to find better ways to fight the cancer because of it?
This is very optimistic, very happy to have heard this. Thank you very much, Dr. Rowe.
Thank you so much for your time.